Good afternoon, everyone, and welcome to Bermuda Cancer and Health Center on this first day of October 2018. Since the 1990s, when the Pink Ribbon campaign began, breast cancer awareness has grown tremendously. And we thank our community for getting behind this cause and helping to raise awareness and remind women of the importance of early detection. This year, we are asking our community to rethink pink. We want women to feel empowered when it comes to their breast health and annual screening starting at the age of 40 years. And while it's true that no screening test is perfect, mammography is the closest thing we have to it, and it remains the gold standard for preventative breast health. And with our introduction of 3D mammography last year, accuracy has improved even more, especially for those with dense breast tissue. We are asking our community to rethink pink and help us better understand the impact a cancer diagnosis has on our community. Although we have a Bermuda National Tumor Registry, which provides local statistics, it's widely known that these figures are not an accurate reflection of cancer affecting Bermuda. This is due to non-mandatory reporting by local doctors and underreporting of those diagnosed overseas. As a registered charity, Bermuda Cancer and Health Center is trying to do right by the Bermuda healthcare system, working to reduce cost and providing needed services while subsidizing costs for those who cannot afford screening mammograms, diagnostic imaging, and radiation therapy. To do this effectively, to meet the needs of our community, and to do our part in building a viable and sustainable healthcare system, we need a better understanding of the true impact cancer has in Bermuda. Should you be diagnosed with cancer, we urge you to remind your doctors to report your cancer diagnosis to the Bermuda National Tumor Registry, regardless of where you were diagnosed or treated. We also ask you to rethink pink when purchasing pink products. Ask yourself who is benefiting when purchases are made in Bermuda. At Bermuda Cancer and Health Center, we can guarantee that the income from those sales and your donations will directly subsidize our screening mammograms, diagnostic imaging, and radiation therapy services for those who are underinsured or uninsured, and will enable the center to continue to raise awareness and encourage women to be proactive when it comes to breast health. Each dollar will genuinely make a difference to the life of someone here at home. We have a month full of awareness and fundraising activities, and we invite you to join us as we rethink pink. Visit our website for event details and use social media to share your thoughts on #RethinkPinkBDA. And with that, I'd now like to turn it over to John White, CEO of BF&M Insurance.
Thank you, Lynn. Mrs. Burt. Mr. Wilson. Partners and guests, good afternoon. BF&M is delighted to join with Bermuda Cancer and Health to launch Breast Cancer Awareness Month and prepare for the 22nd Annual Breast Cancer Awareness Walk. We are honored to welcome Mrs. Burt here today and thank her for her patronage of Breast Cancer Awareness Month, and we are delighted and grateful for the continued support of Minister Wilson. Thank you, Minister. BF&M is committed to playing our part in promoting wellness in our community and encouraging people to take control of their health. Initiatives such as the Breast Cancer Awareness Walk help us all in our fight to prevent, detect, and treat cancer. In addition to the walk, BF&M will once again be hosting the Preventative Health Fair, which will be held just in advance of the walk on the 17th, which will feature healthcare professionals and vendors providing free education about how all of us can become healthier through diet and exercise. We also look forward to welcoming the schools that are competing for the 2018 BF&M School Spirit Award, which this year will include for the first time the primary schools. The top 3 schools overall on the island that raise the most funds will be given monetary prizes by BF&M. At this point, I'd like to take the opportunity to welcome Lynn Woolridge, the new CEO of the Bermuda Cancer and Health Center. Lynn, we look forward to working closely with you and your wonderful team and support you in the incredible work that all of you do in our community. BFNM is proud to support you. Finally, we just want to say thank you to everybody in the community that supports Breast Cancer Awareness Walk. We look forward to seeing all of you on Wednesday, October 17th. It starts at 4:30. The walk is at 6. And we look forward to seeing the minister and all of you here that evening. Thank you very much.
Good afternoon. I'm excited and honored to be back here this year serving as honorary patron for Breast Cancer Awareness Month. This is such an important cause that affects so many of us in our community. For the women diagnosed with breast cancer, their families, friends, employers, churches, and community clubs, pink is more than just a color. So in the spirit of this month's theme, Rethink Pink, I invite you to join me in finding ways to support efforts to end breast cancer this month and all year round. This month, Lynn Woolridge and the dynamic team here at Bermuda Cancer and Health Center have made it easy for all of us to get involved. Personally, I am heading to the 40th birthday party that's ongoing right now here at Bermuda Cancer and Health Center. I will be participating in a Wear It Pink Denim Day at work, and of course, joining John White's team and BFNM at the Breast Cancer Awareness Month walk on October 17th. So I'd like to say a very special thank you to the team at BFNM for their continued enthusiastic support of the walk. I look forward to seeing everyone on October 17th and all month wearing your pink. Thanks.
Good afternoon, everyone. Good afternoon. Push this down. Yes, vertically challenged. Good afternoon, and thank you for this opportunity again for me to be present today as we launch Breast Cancer Awareness Month. Cancer is the second leading cause of death in Bermuda, and worldwide, after lung cancer, breast cancer accounts for the majority of deaths in women. Of all the reported cancers in Bermuda, breast cancer is overrepresented, nearly 29% when listed amongst the island's top 10 registered cancers. During October of every year, we focus on what we can do to help to save lives. A 2016 survey highlighted a total of 78 reported cases of breast cancer on the island. Breast cancer has consistently been the most common cancer on our registry for years. From 2012 to 2016, there was an average of 63 breast cancer cases registered, and most are diagnosed before or at stage 1, which results in a survival rate of 100%. But that does decrease for the diagnosis in later stages. So mammography remains key to preventative breast cancer. With 1 in 8 women, that's right, 1 in 8 women will be told during their lifetime that they have breast cancer. Regular screening and quality care are vital to improving these outcomes. Early detection is critical, not only to survival, but also to quality life, minimizing the cost and invasiveness of treatments when found at later stages. Therefore, it is imperative that all women have mammographies as recommended by your physician. Women and men can take precautionary action by talking with their physician about what they can do to help to lower the risk factors and learn about what tests are right for them. Thanks to the Bermuda Cancer and Health Center's Equal Access Fund, everyone in our community can utilize their services regardless of one's level of health insurance or ability to pay. This fund is made possible through generous donations from our community. There are many programs involved in reducing the impact of the disease, and of course, as we've heard earlier, the Bermuda National Tumor Registry, as the most comprehensive database of all cancer cases in the island, is a pivotal component. An accurate and complete tumor registry is a vital, important source of cancer information for program planning, policy decisions, as well as to help to improve patient care and the evaluation of current practices. The focus is on improving outcomes in cancer diagnosis, treatment, care, and ultimately survival. This information helps health professionals to better understand the disease and use resources effectively for the prevention and treatment of cancer. It is a vital link to reducing the burden of cancer in Bermuda. Our host, the Bermuda Cancer and Health Center, is one of Bermuda's oldest charities. I understand dating back to the end of World War II. So this 73-year-old organization has established a radiation therapy unit right here in Bermuda through collaboration with Dana-Farber and Brigham and Women's Cancer Center. This is a blessing for uninsured or underinsured patients filling a void here in Bermuda because some people were simply unable to pay the cost of traveling abroad for treatment. Earlier this year, the government also ensured that hip and future care patients could also be covered for radiation therapy here locally. And we are grateful to the Bermuda Cancer and Health Center for working with us to make this possible. The screening and early detection of breast cancer is one of the center's primary functions. Indeed, I understand that they service between 600 and 700 mammograms are performed here each and every month. And the center also focuses on cancer education and cancer prevention. Clinical services, not including actual treatment, amount to a staggering 10,000 appointments a year or more, and these include digital mammography, screening diagnostic services, breast biopsies, bone density examination screenings, and ultrasound services, and prostate biopsies. So needless to say, with all of the work that is being done by this center, there's also an all-important fundraising function, which is where all of us can come in and help to support. So here's to the 2018 Breast Cancer Awareness Month theme, Rethink Pink. And I encourage each and every one of us in this whole entire community to donate to this very worthy cause in honor of our mothers, our daughters, and our sisters who we have lost to this disease. Thank you.
Thank you, Minister, Mrs. Burke, and John White. Thanks, everyone, for coming out. Because this is now officially Breast Cancer Awareness Month, I believe I have some walk packs to deliver. And I hope we have the sizes right. Thank you so much, Minister.
Thank you very much.
Again, everyone, thank you for coming out today. Thank you for participating in all the month-long events. To those who are close to and at the age of 40 and just a little bit over, enjoy the birthday party today, and it really is not as painful as you've heard. And besides, we have cupcakes, so that makes it a little bit easier to handle. So again, thanks very much for coming out, and have a great day, everyone.